Welcome to INOvators, a series where we sit down with thought leaders in the healthcare technology space to talk about news and trends that are impacting the industry today. My name is Justine Cincola. I'm on the corporate communications team at Inovalon, and joining me today is Todd C. Sharp, head of strategy for AWS Healthcare and Life Sciences. And if you have been following along with our INOvators podcast, you'll know we actually had Todd with us last year, and today we're going to kind of carry on our conversation from last time. So Todd, thanks for being here again.
Thanks for having me again. It's always a pleasure to interact with our friends at Inovalon.
Great. Well, last year we talked about how technology has advanced to reduce costs in healthcare outcomes. How have we seen that evolve in the last year?
Yeah, I'd say in the last year, what we're seeing is an additional focus on the consumer side of healthcare and life sciences, but we're also seeing an internalization and adoption for modern data strategies and their implementation as a way to get to better analytics, knocking down silos between different teams in the healthcare system, improving collaboration, and opening the doorway towards the beneficial use of AI.
And speaking of AI in healthcare, we know a big topic still is there's been a lot of advancement in the past few years. How is this influencing consumer expectations regarding access to healthcare data and services?
Sure. I mean, one of the things that we see every day is omni-channel communications, right? There's no longer, do I pick up the phone and call, or am I just using text, or am I looking at a portal or an app of some kind? It's consistent communications across all of those channels with patients and participants in research studies. But we're also seeing a generational shift. As the greatest generation is now moving out of the healthcare primary care area a bit, and we're moving into boomers, Gen X, Gen Z, millennials, and soon more alphas, we're seeing a very different shift as to how they want to interact with their data and whether they want it to be 24/7 real-time streaming. Where with the Gen X, boomers, and greatest generation, if you're having a one-time transactional conversation with them, they'll spend 15 minutes to get to know you on the phone and make sure that you get to know them. If you're seeing the millennials, the Zs, and the alphas, if they have to talk to a person, you failed them as a provider. So we're seeing that shift and technology helping adjust for that shift.
Okay. Now, looking at AI and drug development specifically, can you give me some real-world examples of how AI-driven analytics have accelerated drug development? How are these innovations considering social factors that influence patient health outcomes?
Sure. I'll take the second part first with social determinants of health. Being more inclusive. If you look at most research protocols that generate clinical treatments, most of them, over 80%, it's estimated, have been reliant upon a Western European genetic profile. That Western European genome doesn't account for differentiations. For example, African Americans, there's a difference as to whether your heritage is from Western Africa or Eastern Africa. If you're looking at Asian Americans or if you're looking at actual Asians in that part of the world, the population mix and as well as your genetic components can have a vastly different outcome for different treatments from different pharmaceuticals. The other thing that we're seeing, I think, in terms of real-time development, I was here in Washington, D.C. just a few weeks ago for the Children's Brain Tumor Network meetings, and some of the things that researchers are doing with AI right now on AWS are phenomenal. We're actually targeting things through DNA libraries. We're targeting things through protein folding. We're doing specific molecular drug development where life sciences companies are able to target cohorts and candidates earlier with precision before they have to just go survey and find things. They're actually able to use AI to target those things with more precision so they can be on target and improve outcomes.
That's awesome. Let's talk a little bit about collaboration. What are some of the best practices for fostering collaboration between healthcare providers and life sciences organizations looking to kind of create that aligned data-driven strategy that's going to address the diverse needs of different patients?
Yeah, some of the challenges historically has just been siloed data, whether that's in a research area or if it's in a provider arena or life sciences, just having silos that don't really foster collaboration. So from a technology perspective, once you have the agreements in place to work with one another, it's important that you align around modern data strategies and modern data models. That allows you to share securely and privately in a way that doesn't compromise your research or the data integrity, but allows everyone to have an aligned view. We've seen that as probably the top alignment, top way to align by democratizing that data amongst trusted partners.
All right, Todd, tell me a little bit about health equity and how this plays in there.
Looking at the social drivers or determinants of health and looking at all the regulatory incentives. So you have health equity, you have HEDIS, you have STARS measures, you have different things that are coming into both the provider, the payer, and the life sciences realm to make sure that we're accounting for all of these different factors. You're getting a regulatory environment that now supports better outcomes longer term over different populations. That's a unique environment. We've not seen it quite at the scale that we're seeing it today, nor are we seeing acceleration like we've seen through the advance of technology in these areas. Where we're going with this is clearly artificial intelligence being on the lookout for these identifiers and these markers, whether that's on the life sciences side of the bench or whether that's on the patient care side of the bedside. And what I expect to see happen over the coming years is that precision medicine is going to really start going, instead of bench to bedside, it's going to be really more data to bedside, where it's going to become standard practice and care, more widely implemented earlier in the process.
That's awesome. I know we talked last year, and clearly there have been so many advancements in just the last 12 months. But before we wrap up today, one question I would love your thoughts on is, what are you the most excited about in even the next 12 months to come?
I think the next 12 months to come is, we have LLMs and foundation models and artificial intelligence that we're talking about all these things, but it's really the revolution of not only the point of care for the health of the patients, but it's the point of care for the health of the ecosystem. We're seeing collaborations between pharmaceutical, life sciences, payers, providers, and there's an NIH paper out there even that says that there's an 18% lower cost of delivery and care with improved outcomes through collaboration between these partners. And that's what we're going to see much more commonly going forward, rather than some adversarial and contract-driven relationships. We're going to have AI pointing out those points of commonality, so there's less debate and more efficiency.
Well, how about in 12 months, we'll sit down here again, have this conversation, and kind of see what has evolved. So same time next year?
I look forward to it. Thank you so much.
All right. Thanks, Todd, so much for being here. And as always, thanks to our audience for tuning in. Be sure to join our next episode of INOvators.